Good afternoon, everyone. Welcome to our COVID-19 update. We are glad you are joining us to get current information about what's happening related to COVID-19 in the area. I'm pleased today that we have both Luke Feedy with us, who is giving us our usual Monday update related to mental health, and also Angie Weideman, who's been here frequently from Chippewa County to share what is happening in Chippewa County related to COVID-19. Our efforts, both Director Weideman, Angie Weideman's efforts, as well as the efforts across this region, are really well coordinated as local health department directors, and it makes a difference that we are working together in paying attention to this disease and responding. So we're glad that the group is here as well. We will share some state data, as we usually do, as well as the local data from Chippewa first, and then Eau Claire, and then Luke will follow. We'll have time at the end for questions from media. It has been a busy weekend for our team, a lot of contact tracing and a lot of work making sure that we are understanding who has COVID-19 in the Eau Claire area, as well as following up with all those close contacts. We will share that on Wednesday that we have many new outbreaks. That's the day we usually share more information about outbreaks, but it is something that is happening in this community. I hope that you took some time over the weekend and since last week to really think about the important point we are at with COVID-19 and what will be happening in the next few weeks. In our community, we have K-12 schools starting. We have UW-Eau Claire and CVTC starting. All those opportunities for us to do the things that we need to be doing are also opportunities where COVID-19 can spread if we are not working together to make sure that we are paying attention to the basic public health principles that will help us slow the spread of this disease. We want students to be back in person. All of us want that. We need to think about our role in making sure that that continues to be a real possibility as much as they are able to be back, both our K-12 and our higher ed students. We can do something about that, staying 6 feet apart, wearing our mask when we are in settings of close contact with others, making sure that if we have minor symptoms that we are staying home and not spreading disease, even if we have mild illness, getting tested if we have symptoms of COVID-19, washing our hands, all of these will make a difference, as it is true with other diseases. The difference with COVID-19 is that this is a novel virus. We know that it will spread rapidly if we are not paying attention to some of those basic principles, and we know that it has caused considerable issue across our state and nation. Some basic data available from the state level. Negative tests for COVID-19 are now at 1,119,622, an increase of more than 4,400 tests since Sunday. Total positive cases of COVID-19, people that are Wisconsin residents that have had COVID-19 or have it, is now at 70,854, an increase of 392 individuals tested positive for COVID-19. 5,573 of those people have ever been hospitalized, and we are now at 1,081 deaths. Again, Dr. Westergaard today in a meeting said that this is usually the good season for respiratory viruses. Usually influenza, for example, a respiratory virus we deal with every year, is bad in the winter and early spring months and better during the summer. We don't see deaths from typical respiratory diseases during the summer, pneumonia, influenza, those kinds of respiratory illnesses. We are seeing them with this disease, and that's why we need to pay so much attention to this. Over the past 2 weeks, the state on average has been above 700 new cases per day. The positivity rate is around 8% as of yesterday, which has been a slow increase at the state level for the last couple of weeks. Angie now will share a bit more about Chippewa County. I'll be back to talk a bit about Eau Claire County, and then we will finish with Luke and question and answer. Thank you.
Thank you, Lisa, and thank you to the Eau Claire City County Health Department for having us today. Good afternoon. My name is Angie Weideman, and I'm the Health Director for Chippewa County Department of Public Health. I'd like to start with an update on current case information for Chippewa County. Chippewa County currently has 304 positive cases. 30 of those are active, and 274 of those individuals have been released from isolation and public health monitoring. There have been 11,610 people that have had negative test results for Chippewa County and 0 deaths in Chippewa County. In addition to working on communicable disease, health departments work on a number of health priorities, including promoting a healthy, active lifestyle. Good nutrition is an important part of leading a healthy lifestyle. Combined with physical activity, your diet can help you reach and maintain a healthy weight, reduce your risks of chronic disease like heart disease and cancer, support a strong immune system, and promote your overall health. With fall fast approaching and summer nearing its end, it's time to get outside and have a few healthy activities. Check out some of the great biking trails and walking trails in the Chippewa Valley, and visit one of our many farmers market in the area. They are a great way to support local farmers and artists and incorporate fresh foods into your diet. Please remember to practice physical distancing and wear a mask when you do visit a farmer's market. Also, you can try meal planning. Meal planning is a great strategy for families, especially with the school year starting, to save money and time while consuming healthier, well-balanced meals. When possible, get kids involved in cooking and planning the meals. It's a great way to spend time together, and research suggests that it may make them more likely to choose healthy foods in the future. Switching gears, I want to remind everyone that there is a statewide mask mandate that is still in effect. Consistently wearing a mask that covers your nose and mouth, washing your hands, and practicing physical distancing will help reduce the spread of COVID-19 in our community and also help save lives. Wearing a mask is not just about keeping ourselves safe, it's also about keeping everyone safe at work and in our communities. For some people, wearing a mask is not always possible, and they may have a condition that prevents them from wearing a mask, and that condition might not always be visible. Kindness counts here too, so please do not judge when you see someone who is not wearing a mask. And now Lisa will be back to give more Eau Claire updates.
Thank you, Angie. Again, critical, important reminders for all of us. Wearing a mask and finding ways to be healthy are important for everybody to think about. I really have been impressed in Eau Claire County to see people really leaning into finding ways to be healthier. That will make a difference with COVID-19 as well. The healthier we are, the more likely when we get ill with this disease that we will have a stronger body to withstand it. And we definitely want to support that for all of us to be as healthy as possible at all times. Eau Claire updates. We are now at negative tests for COVID-19 at 17,271, an increase of 555 tests since Friday. We have 728 Eau Claire residents who have tested positive for COVID-19, an increase of 29 since Friday. And we now have 6 individuals, Eau Claire County residents, who have died related to COVID-19, 2 more since we last reported to you. Both of these individuals were over the age of 50 and did have underlying conditions, but 2 people that have been hugely impacted by this disease, and their families have as well. Ever hospitalized for COVID-19 in Eau Claire are 37 individuals, with 668 of the 728 considered recovered, having completed their isolation time. On Mondays, we also traditionally report to you jail-related data. We are now at 133 individuals connected to the jail tested for COVID-19, with 7 positive cases and 7 recovered cases. The testing numbers reflect our National Guard testing site efforts a couple of weeks ago, and we have had no new positive cases. A couple of things that I will cover from an Eau Claire perspective before we have Luke come up. There have been lots of conversations locally about school sports in the last couple of days. Many are aware of the protests and the marches that happened in Eau Claire County both last week and this morning. I am aware of both of those events that took place around the courthouse and did choose on Friday and again today to go out and talk to those young people that were there. They deserve the respect and the acknowledgement of their challenges with school sports this fall. They were actually leaving the parking lot in both instances and came back after I told them that I was there once I found out about them being present, and had good conversations with them about what was happening. Again, this is tough. This is tough for those individual students. This is tough for families. We are seeing sports impacted at a local level, as well as at a collegiate level, as well as at a professional level. I think we are all well aware, those people that follow sports, that sports looks different even at a professional level right now. Certainly, many collegiate sport teams are not playing, including UW-Eau Claire, because of COVID-19. If we had a choice about how to control the spread of disease with our interactions that are in close contact by really careful testing of everybody regularly, daily testing is what is happening with professional sports teams, we certainly would have a better idea of when to be able to be in group settings and when not, whether it's sports or any other kind of group activity. But we don't have that kind of capacity. I want parents and young people to know that I understand this is hard, that I care about it, and that it's difficult. I also want to make sure that they are heard as they are struggling through and thinking about what COVID-19 means for them as young people. I also want to make sure they have the right information. So the local order in Eau Claire speaks to no specific activity being eliminated. It's really based on risk. It's related to maintaining 6 feet distance, staying home when you're sick, monitoring symptoms, and making sure, because of a state mandate in addition to what we have locally, that a mask is worn. Those are basic, common sense, disease-connected principles. There's nothing in the order that says that physical activity can't happen. There's nothing in the order that says people need to stay home and socially isolated. And in fact, for young people, we all know that mental health is an enormously important issue. It's true for all of us. We want people to not be socially isolated. We want people to connect. We need people to be physically active. It's critically important. This disease is about closer than 6 feet distance, primarily for disease spread. That is the problem related to COVID-19, and that's the problem addressed in the order. So there are some things, going to a restaurant, going to a local bar, going to a bonfire, going to a football game, that create challenges related to that 6 foot distance. But there are many, many, many things we can do, even in some of those settings, to keep distance and to stay safe. And that's really what we're challenged in this community to do, is be as safe as we can be by following the basic principles of public health. So again, we all want school to happen. We all want businesses to be open. And the work we do together to keep physical distance, to keep our circles small, to keep the spread as slow as possible. Again, we're going to see increased disease. We all know that with the start of school. We all know that we're bringing more circles of people together. Our goal is to keep things as slow as possible, and we need to do that for one another, so we keep our businesses open, so we keep our schools in session, so we keep workers able to work. So again, our intent and our commitment is to make sure people are connected, make sure people are physically active, and to not have 6 feet distance be a challenge. This week, we also, actually today, it is only Monday, we also met with downtown area businesses related to practices to implement creatively and proactively with UW-Eau Claire college students, starting to move back into the community, as well as students that are leaving our community to talk through what that means for Eau Claire County. So particularly 11,000 students with UW Eau Claire starting class in person will be something that we all need to pay attention to as that begins. Meeting with those local businesses and with the city and UW Eau Claire and CVTC was a meeting that happened this morning with really positive interaction about how we have shared interest in this going well over the next number of months. We'll continue those conversations and obviously have been very engaged with all those partners for many months already. So I'll turn it over to Luke Feedy, and then all three of us will be available for questions after that.
Thank you, Liska. Thank you, Angie. So in the infamous words of Jon Snow from Game of Thrones, winter is coming. I know it's hard to believe when it's 90 degrees outside, but it is on its way. Along with the change in weather will be less opportunities to gather outdoors to meet with friends, family, and coworkers. The cold weather and the early nights often lead to many of us wanting to hunker down and avoid the interaction with others. For many, winter can be a challenging time. Seasonal affective disorder is a very real disorder and can have significant impacts on someone's mental health and well-being. Many of us here in Wisconsin have experienced a handful of winters and know what to expect. Colder weather, cars in ditches, and shoveled driveways are just a few things that are definitely in our near future. What we have not experienced together is the winter with the added variable of a pandemic. This pandemic has changed the way that many of us interact and spend time with one another. It will have an impact on how we spend time with each other over the winter months as well. Things like winter sports may be impacted by the pandemic, and many of us count on these winter sports to provide us with some level of structure, to give us something to do over those long months. Some of us plan vacations over the winter months as well, or gather together with families, and we'll need to be creative about how we do that as time goes on. With all of that being said, there are things we can do to take care of ourselves and each other. Many of us have moved to a place where we're much more comfortable with using electronic communication. Things like Zoom and FaceTime are apps that many people are using on a regular basis. They allow us to mitigate risk while also staying connected with one another. These new skills and technologies will be things that will be especially important to use over the winter months to stay connected with family members, with coworkers, with friends, when we can't come together face to face. This winter will also be will afford us an opportunity to explore new hobbies that may be more individual in nature. Perhaps you've been thinking about learning to snowshoe or cross-country ski. This may be the perfect time to add these activities to your self-care regimen. As we know, getting outside and doing something in nature is vitally important to helping manage your mental health. While we take care of ourselves, we can also make sure that we are checking in on others. The old belief is that someone is fine until they tell us they aren't. We are asking that perhaps we shift that perspective and not assume that anyone's fine until they tell us that they are fine. Reach out and connect with individuals. Ask people how they're doing. If there's any point where you're concerned about how someone is managing, open up that dialogue. Ask them what you can do to help. Continue to check in on yourself throughout the winter months as well. Focus on what you already know can be beneficial for you. If there are things that you enjoy doing to help offset a poor mood, focus on doing those things. Build that into your schedule on a regular basis. As we navigate this winter and this pandemic together, we are stronger and healthier when we support one another. Thank you.
Thank you, Luke. Hard to believe on a 90-degree day that winter will come soon, but that is definitely going to happen. It's also interesting that he started with comments from Jon Snow. For those of us in public health, Jon Snow is the father of epidemiology and the person that broke the kind of mystery around cholera, which was a disease that was the pump handle disease found to be spread by water. So interesting connect with a simple name. Again, please remember to go to the Eau Claire website for information about Eau Claire with COVID-19. Chippewa also has a strong website with data and information available. The Eau Claire site is covid19eauclaire.org. If you have questions related to COVID-19 that can't be answered there, you can certainly call our call center number. That number is 715-831-7425. We will be back on Wednesday with our Facebook Live event, again, answering media questions at that point in time, so please join us for that. And now the three of us are available for questions. Yes?
About the two new deaths since last week, I was wondering if you could comment on whether either of those people had been hospitalized in Eau Claire County before they died.
So the question related to our two additional deaths that are Eau Claire County residents, about whether those people were hospitalized. I actually don't have the answer to the question for both of them. I know one of the individuals was, but I am not certain, but we can certainly find that out for you.
And just a quick follow-up as well, the CDC test website says that those two deaths happened last week on August 18th, August 20th, which was last Tuesday and Thursday. Is that correct? And was the reason we didn't find out about those deaths until this weekend, was that just because the cases are kind of really going to stay first before coming out?
Yeah. So the question is related to the timing of when we hear about a COVID-related death. The state indicated the timing of those deaths was earlier last week, and we did not find out about at least one of them until later last week. We did get notified after our Wednesday press briefing for both of those deaths, and timing of those is always making sure that the data is verified and we talk directly before we are announcing anything publicly. We also have decided not to send out a press release when there is a new death, but we update that on Mondays and on Wednesdays when we're aware of them. Any additional questions? All right, thank you everybody for joining us. We'll be back on Wednesday with more Eau Claire information, and please find ways to keep each other healthy, wear your mask, wash your hands, stay home if you are not feeling well, and maintain that 6-foot distance. Thank you.